Wyoming. Right now, the Northern Plains states, I think you know, rank number 1, 2, 3, and 6 in the country for cases per 100,000. We can continue to see rising cases, rising test positivity, and rising hospitalizations throughout the Northern Plains states. We also see that in some of our Rocky Mountain states. We believe that is because part of many activities have been outdoors throughout early September, and there was a dramatic cold snap where people moved a lot of their outdoor activities indoors. We know now a lot about silent, asymptomatic, people who don't think they are infected with COVID but are, and are innocently passing viruses to others. And so we really talked about some details about the work of the amazing work here done by testing, both the tribal nation testing, but actually, Governor, your staff have done really a remarkable job weaving together very aggressive testing and available to communities, finding asymptomatic individuals both in the tribal nations, but also doing wastewater testing. And I tell you, this combination of testing that has been done here is equivalent to anything that we have seen at the best universities. And I think this really shows the work that the state can do when they work in partnership, bringing together their health and science and data with the community together. And I just want to thank you, Governor, for your strong work there. We know that over these next ensuing weeks are going to be difficult, and we talked about how can we better support and bring additional testing to the state to really work with both the tribal nations and the community of people of Wyoming to really help communities come forward for those particularly under 40, under 35 that we know are most likely asymptomatic, and really figuring out how to do weekly regular testing. We have this new test. We have a series of antigen tests that are more widely available. We have about 3 times as many antigen tests as we have nucleic acid tests. We're doing about 1.2 million nucleic acid tests a day. We have the ability to do 2 to 3 million of the antigen tests per day over time as we move into November and December. And we really talked about how we could facilitate that additional testing. I think the work that's done here with saliva testing and wastewater testing and the creative approach to testing, the expansion in the public health laboratories, shows the level of commitment that the governor and his team have made to testing. We've heard that also from the Northern Arapaho tribal clinics. And just want to applaud that work, but in addition, we as Americans need to continue to bridge to a vaccine and really do what we can over these ensuing weeks. We know what works. We know that wearing masks and physically distancing and washing our hands, and most critically, really understanding that when you have an event in your house or you go to an event somewhere, if it's outside of your household, there could be individuals there that are asymptomatic, do not know that they have the virus, and are spreading that virus. And if you and everyone there doesn't have their mask on, virus is spreading. And that's what we see is happening across the Northern Plains states. And so coming together as a community of Americans over the next 4 to 6 to 7 weeks is really critical. We see cases rising in county over county. The most rapid rising counties are Laramie, Albany, Natrona, Fremont, Campbell, Sheridan, Park, and Bighorn. But we have a third of most of all your counties in what we call the red zone. We see the slope of your increase in cases reaching a critical level, but we know how to stop it. And we're really calling on everyone in Wyoming, as we did in Montana, North Dakota, and South Dakota, to really come together, wear your mask, physically distance, but really pay attention to what you're doing in the household, in both public and private spaces, to not gather in that way that we know is spreading the virus, while we work on really bringing additional capacity here with these antigen tests to really ask every Wyomingite to come forward and get regular testing. And so we really want to work with both the tribal nations and the great governor and your superb epidemiologists and your state health officers to really put together a program that can really help us find what we call the silent spread, with people that really don't know they're infected and are spreading the virus to others. So really want to thank you, Governor, and thank the tribal nations and the chairman. Thank you for coming and talking to me. That dialogue and listening and learning has been critical. This is, I think, almost our 40th state that we've been in over the last 4 months, and we have learned a tremendous amount. I can tell you when I go back, we will feature the governor on our next governor's call to really talk about what he's done with testing at the state level, bringing together innovation and science to create new tests and new approaches along with wastewater and other testing. And we just want to be a partner in that and bring that together to really serve the people of this great state. And it's just been, we got to drive through your Wind River Canyon. It's beautiful. That physical beauty needs to be matched with our personal responsibility to each other. And we just really want to thank you for the reception, thank you for finding the space, and really thank you for the people of Wyoming that were really, it's really a call to action, a real call to action for us to change our behaviors over the next few weeks to really change the course of this pandemic, as they did with the southern surge that we saw in June and July and August when it got hot. And people moved indoors to cool. So we know how to do this. We need to do it together. I can take a couple of questions. Yes, ma'am.
Hi. First off, thank you so much for coming and allowing the media to ask you some questions. My name is Morgan. I'm with the Vesper Star Tribune. And my question is, in late September, the White House Coronavirus Task Force recommended to the governor that the state mandate face masks in counties designated red, orange, or yellow by the task force. And then in subsequent reports to the governor, that recommendation was no longer included. So my question would be, why the change? And given the increase in cases since late September, do you think that masking should be required in counties or statewide?
Well, we continue to recommend face coverings and masks and throughout the governor's report. Frankly, we've been adding more and more bullets every week of new science and data that has come available. Probably within the next several weeks, we'll compile everything that we've learned from the 40 states to really highlight what governors have done to stop the spread of this virus, because we think governors and mayors and tribal nation leaders, chairmen really understand their community best about how to bring these guidelines forward. I think we've been very clear on what the guidelines are, and of course we follow the governor's lead on how they think it's best to be organized. We have seen people wearing masks in Riverton and in the other small towns we stopped in on our way here. I should remember all of them, but I won't right now, but they were beautiful, and people were wearing masks. But I think we really do need high-level mask compliance. We know they work. We talked about how every child of Wyoming right now could go outside without their mask when it's cold and blow and see their droplets. We've all seen that our breath looks like. What you're seeing is your droplets. And so do that without a mask and do that with a mask and show how it contains your droplets. I think that's the best example of how we can really show each and every person of Wyoming why masks are effective in preventing spread. Yes, sir.
Yes, Ernie Over from WyoToday.com and the Wind River Radio Network. Wearing masks has become a political issue in our community and around the state. What can you say to those people who are refusing to wear masks, that this is important to stop the spread of the disease?
Well, I can tell you the virus is not political. And when I see the individuals coming to the hospital, I was privileged to visit 2 of the major hospitals in Montana, and I just want to give a shout out to the healthcare delivery staff here and across the Northern Plains who are confronting this virus. And you should hear their stories of the grandparents who have been lost to this virus. Because like in my household, when my grandmother brought the great flu back home in 1918 to her mother, and her mother went on to die, that is what you carry for the rest of your life. We owe it to each other to wear a mask. The virus does not distinguish between young, old, Republican, Democrat, or independent. does not distinguish between party. It's about Americans, not our party affiliation, that we're asking people to really follow those public health guidelines.
Thank you.
Yes, ma'am.
Hi, I'm Claire McFarland from the Ranger in Riverton. By the time a vaccine is found viable, if you were to make a rough projection, about what percentage of the population would you say will have had the virus already by that time?
Well, the CDC has done really a terrific job. They're not only collecting the cases from every single state, and we want to thank all the public health officials who've been providing those case numbers month over month, but they've also been studying the antibody levels of all the states across the country. They found the majority of states, particularly in this area, less than 5% so far have become infected by their last analysis. That went through the end, I think, of August or the middle of September. Areas that were hit particularly hard, in fact, one area that was particularly hit hard, New York City, had the highest antibody levels, which shows you that you can get in a massive pandemic about 20% to 23% of the population in that wave infected. Now remember, we were also in a shutdown there, so we stopped the viral spread. But we know from herd immunity studies around vaccines, achieving herd immunity through vaccines, that if you can get the vaccination rates up into the 75–80% range, that it can have a dramatic impact. That's why all of you immunize your children against these diseases. You can see when people stop immunizing their children, there are measles outbreaks. So we know what parameters you need in order to have effective immunity to block transmission of disease. The only way we can get to 80% is through a vaccine. Because even in the hardest hit city with a lockdown, they got to 23%, but they have, New Jersey and New York still stand in stark contrast to every other state, the number of fatalities that were there. And so I don't think anybody wants to accept ongoing fatalities. What we want to do together is control the virus early enough that those vulnerable individuals in our communities that live among us, not just in the nursing homes, the ones that live in our household. I have a 91-year-old and a 96-year-old parents. I have to protect them. That's my job as their daughter. But my granddaughter right now is protecting them because I'm on the road. But that's what we owe to one another. People live among us with those comorbidities. We just heard from the Great Northern Arapaho Nation that they had over 700 people with diabetes. So you can't tell that someone has a comorbidity. You can't tell if they have diabetes or not. So we need to assume that we are among those who need protection, and that's why we need to wear a mask. I don't think even in this current wave that we'll get past 10 to 20% of people infected. So that's why we need a vaccine, but that's why we know right now how to stop these cases. But it takes all of us together.
Thank you.
Yes, ma'am.
Thank you. Katie with WildFile. You said that face masks work, and you were just talking to the leaders from the tribes, which have mask mandates. Are face covering mandates more effective than face covering recommendations at reducing the spread of the disease?
I will tell you, there have been studies, state by state, country by country, that look at that specific issues and find that mandates are effective. I can't tell you right now as one is more effective than the other, because what has happened in many of our states, if the governor recommended masks, oftentimes the mayors of every large city and every county did a mask mandate. And so there may not be one at the state level, but each of the counties and each of the cities had a mandate. The reason the mandates are sometimes very helpful, because they're helpful to me when I'm reminded by going in retail establishments to wear my mask. And it helps those retail establishments require those masks then of the individuals who come in. And so it's not that you need government enforcements, it's that we need constant reminders when we're in public to wear our mask and to constantly remember to wear our mask. And even though I've been in this mask almost solid for 6 months, I still need reminding. And that's why it helps to have retail establishments requiring and mandating masks, because it reminds us to change our behavior.
do one or two more questions for Dr. Burks.
Yes, ma'am.
Thank you so much. Abby Meidel with Wyoming News Now. Have there been any studies on the psychological effects of people with required masking and mandates, specifically with children in the school system as well as the elderly within their care systems as well? Have there been any psychological studies on the effects of that? And if so, if there have been, and if it's negative, what are the efforts that we can do to mitigate the negative psychological effects personally and potentially as a state?
What we do know is there have been psychological effects from the anxiety of dealing with COVID-19, and I think the more that we empower ourselves to prevent others from getting infected and we get those cases down, we'll have less anxiety and concerns about it. I know from K through 12 teachers that they tell us that the children have adapted very well to masking. And for the children that have really been in school the longest in Europe, I haven't seen any studies that specifically address, but I will look for them now. It's an excellent question. And so I will look for that very specific study. There may be some out of Europe. I haven't seen any in the US, but I will look for that because I think it's really a terrific question. Thank you.
Any more questions for Dr. Burks?
Yeah, so just long as everybody else got to ask one. Okay. So you commended the state's testing program, and you've given us some specifics, but could you speak a little bit more to what you've seen in Wyoming as far as testing goes that maybe other states aren't meeting, or what really is setting the state above the rest in that regard?
Yeah, I think it's a great question because we heard that from the Northern Arapaho tribal leaders that they really understood the importance of asymptomatic spread. And I think we've also seen when the state puts in wastewater testing and really encourages people to get saliva tests and makes it convenient, it's about not just testing people who have symptoms, but importantly, testing those who may not have symptoms, which means you have to do much more broad-based testing and also set up sentinel populations that will contribute to that knowledge about that community. And that's already being worked here, both among the tribal nations and also at the state level. Of course, I come out of public health and I always want more. And so that's why we had a dialogue about Binax and how to use antigen tests to really make testing almost fun and available so that we can really encourage those under 35 to come forward and get routine, regular testing. And that's how you find the asymptomatic. So we talk about the experience that universities have seen, and I just want to thank the university presidents that trusted their students enough to bring them back to campus, because we have seen two different models in universities. One model of really testing for symptomatics and contact tracing. And the state has done a great job also with contact tracing. But universities that tested primarily for those who are symptomatic and contact traced had about 15% of their student body infected. Those universities that tested every student weekly, at a minimum of weekly mandatory required testing, they have less than 1% of their student body infected. And I think that's the difference if finding the asymptomatic individuals who, again, I just want to make it clear, they don't know they're infected. They feel fine. And so it's hard for people to understand that you could have a virus replicating in your body and still feel fine. This virus causes infectiousness in those groups that feel fine to all the way serious illness, hospitalization, and actual loss of the Americans that we, particularly over 70, are those with comorbidities. So this same virus can infect people and cause really minimal to no symptoms, and it also is deadly to others. And I know that's difficult for people to understand that spectrum of disease because it's unusual to have a virus that does that broad of a disease. And so people think that you have to have symptoms to have the virus. You don't. And it's really that group that we're worried about. People who have symptoms will come forward and get tested. Those who don't have symptoms, you have to make testing available in new ways and setting up sentinel surveillance population, whether it's teachers or police or community college students, along with the staff that they've been testing regularly in nursing homes to protect the nursing home. But right now, about 30% of your nursing homes have at least one positive staff member, which means, again,
that the virus is coming in from the community into those nursing homes. And so that's why stopping that community spread is really critical. By the time it gets to the nursing home, it's a threat to those residents. By the time it gets into the tribal nations and the reservations, it's a threat to those multi-generational households. And so it's on to all of us to really innovate as they have done here and really expand and continue to expand the great testing platform they've already established. So I just want to again thank the governor, thank the chairman for your warm and open welcome, and really thank you for teaching us, because every state we go to, we learn something tremendous that we then take to the other state governors. Every governor has done something brilliant that we have learned from in their state. And so that's why it's been a privilege to be in the United States, traveling around and hearing firsthand these innovations that governors have brought. Thank you very much, sir.
Thank you, Dr. Burks. The governor has time for about 5 minutes, maybe tops 10 minutes worth of questions if anybody has additional questions for the governor for tribal members.
Travel safely. Thank you.
Yes.
You have been urging and admonishing personal responsibility from the beginning, over and over again. Cases continue to climb. Do you see limits in personal responsibility?
I don't see limits in personal responsibility. I think what we saw in the emergence and progression of this disease was initially people saw the challenge, they responded, we took our caseload down. Throughout the course of the summer, we did remarkably well. We were among the lowest in the country, and I think people began to think this isn't that big a deal. And now we see how infectious it is. We've seen the growth and the spread. And what I want to say is that each county will probably, and the tribes have themselves, responded as is appropriate on a local level. So clearly what's happening in Albany County isn't exactly happening in Niobrara. And so I think that what ties all of that together is our common desire to do the right thing for our state, for our neighbors, and for our population. What's been particularly, I think, difficult is when we talk about comorbidities, we talked about diabetes. It's a treatable disease and people live long, very productive lives with diabetes. It's not a death sentence. And when we see the two combined, sometimes it can be. And so I think people have maybe not taken it as seriously as they need to. What we heard today, and I don't know if you all felt the same way, but I think we heard that it's a very serious progression. It's going to take several weeks to work its way through, and there will be more deaths as a result of it. Thank you. Yes?
Hi, Governor. Thanks for being here. I actually have a question for both the Governor and for the tribal leaders that are here, which is there a point in this surge of cases that we're seeing, do you have a point in mind when you'll consider putting restrictions back in place?
Well, for me and for the state, the way the state's responding, Dr. Harris and I work on a regular basis. We feel that it's important that the local communities which know the right course of action, for example, Teton County early on took very, strong stance on face coverings and other aspects. And you can see that they're doing particularly well. Laramie County is now considering something similar. And what I will say is that our schools, where we have this very strong recommendation for face coverings, the schools are, in some ways, the very safest places to be in the state right now.
And for Chairman Spinnaker, is there a point when you'll consider putting the stay-at-home order back in place?
So we work closely with our Woodruff Community Health Care medical team there, our chief officer and our CEO and the clinical director. We're implementing back into place weekly meetings with them to go over the numbers and to see where we're at as far as coronavirus is at present time. How is it affecting us? And also, we will work with them and also Indian Health Service on our Eastern Shoshone side and their tribal health program, so that we can bring the best data, the best information, the best science to Wind River Tribal Council, so we will make the best decision for the safety of the reservation for both tribes and our people.
We're actually out of time. The governor has to make another appointment, so I apologize. I'm going to have to move him. Dr. Harris is still going to be here for a couple minutes if you have a question for her after you get that.
Yeah, so a question for you. Are you guys at this point, it sounds like you were relying on local governments to, make the moves that they feel are appropriate to them. In communities where cases are really surging that don't currently are not in the process of enacting mask mandates or any additional restrictions, is the state recommending that those communities do impose those restrictions?
I think, first of all, just to state that I think it's very clear how the Department of Health, feels about face coverings and how important they are in preventing transmission, slowing transmission of this virus. I think, it's important for people to kind of imagine how, they can walk into a grocery store, affect somebody else, and how that chain reaction, could end up in having an infection in a long-term care facility or nursing home, leading to a death or many deaths. And so just to really emphasize how strongly we feel about the importance of wearing face coverings in public settings when you cannot be, socially distanced from others. I do talk with the county health officers every week. We discuss the situations in their counties. We have very close contact, with the public health nursing offices and county health departments in discussing, contact tracing and the rest of the response. And we do discuss, what could be effective in each county to slow the spread of the virus. Each county is different. There are different factors in play, and it is important for each county, each jurisdiction to consider what would work best for them. Along with mandates, there are other strategies as well. Testing, we are trying to get as much testing out there as possible. Each county jurisdiction has access to testing, surveillance testing for high-risk populations, for those asymptomatic populations. They are each doing a fantastic job in getting that out there and getting as many people tested as possible. It's important that people come and participate in that. We want employers to participate, government offices to participate. Same with contact tracing. There are incredible efforts going on around the state, including by the Northern Arapaho and Eastern Shoshone tribes, to contact trace every single case and every single contact. So it's important that people also participate in that. There is not one single answer to this pandemic. It has to be a multi-pronged approach, and it does have to be based on what's most appropriate for that particular location.
Hi, Dr. Harris. Thanks for being here. Fremont County has been without a public health officer, I think, since August now, and I know that your office has stepped in to help, but does that concern you that one of the counties with the highest caseload still doesn't have a head of its public health department?
Yeah, certainly I can't really overemphasize the important role that county health officers play. They are providers. They are providers seeing patients in the community. They understand what's happening in the community. And so I do think it's important for every county to have a county health officer. But certainly the public health nursing office is still here. Becky Parkins, the county nurse manager, is doing a fantastic job. We're again in close contact with them. But I do think the county health officers play a really important role as a link to the communities, and I would like to see every county have one.
I think it was last week, the governor announced that the state's working with a private company to help contact trace, but didn't give any further details. Can you tell us what that company is?
Sure. The company, and I'm sorry, I probably don't actually have all the minor details, but the company's name is Waller Hall. They operate and have sort of relationships with call centers around the country. And so we have contracted with them to operate a contact tracing system for Wyoming, with some callers based here, some callers based around the country. So that contract has been signed. We are in the process of conducting training for that group of contact tracers, and we hope to bring them on board either right now or later this week.
And do you know how much that will bump up the state's contact tracing capacity?
Sure. So we are hoping to have 30 additional contact tracers through them to start with, and then we'll certainly look to expand further as needed. We're also looking to bring some additional people on at the state level as well.
Dr. Harris, how are some of the smaller counties, I'm thinking Sublette County, Niobrara County, et cetera, where they don't have a lot of beds, let alone a lot of ICU units, how are they handling surge?
Yeah, thanks for that question. Sublette County, as you know, doesn't have a hospital inpatient facility at this time. I think that the hospital sort of network system in Wyoming is very important, where we have community hospitals. If there are patients that are too ill or need to stay for longer, that they can go to a higher level of care in one of our larger hospitals in larger cities. And so that is very important to remember, that even in a location that maybe not having a surge of cases right now, a surge of cases in Casper or Cheyenne or Gillette, where that hospital is full, is going to affect the ability in those smaller counties for patients to be able to receive that higher level of care that might need. That it is really a state network, and the hospitals work together. They have systems that work together, and any really problem or surge in one hospital is going to impact all the others.
Hi, thank you so much for being here. I really appreciate it. Abby Michael, Wyoming News Now. Is there any point at the numbers of percentages of positive cases or deaths or anything like that, is there at any point that we're considering lifting the mask mandate within the school system, being that children are at a lower risk, or potentially, having some members wear them, some not, just a personal experience along with a few conversations with health officials that wanted to remain unnamed. The health risk of potentially actually making it worse for the students who are touching their facial coverings so often. And even, like when I send my son in the morning with a fresh mask on and it's all good to go, by the time he comes home, it's just disgusting. And that's with following, all the rules, taking it on, taking it off as they are allowed to within the social distancing. There is certain occasions where they are allowed to take it off, but just with that increase of touching it, taking it on, taking it off, is there a possibility that it is increasing the risk? And if it isn't, will we keep the mask mandate, or if it is, do you think there's a possibility that it will be lifted at all?
Sure. Thank you for that question. I would say that mask use doesn't have to be perfect to be effective. What matters is the more people wearing masks, and the more frequently, the more often in those high-risk settings that they are wearing them. There is an exception in the orders if teachers or parents are observing behaviors in their children which might increase the risk of infection. We realize that some children, especially even maybe younger children, may have some difficulty. And so if that is the case, there is an exception to the orders for that. We have seen that masks in schools work. They work. As Dr. Birx mentioned, there are studies, that CDC is looking at right now, that potentially that 6-foot distancing is not as necessary, or maybe we can reduce that if people are wearing masks. We have seen it work so well in schools that we're able to not have to quarantine kids if they're wearing a mask but may not be quite 6 feet away from each other. And of course, it's also important that children certainly can get this virus. They can get sick from this virus. You're right, it is, they are less likely to get severely ill. Than, that risk increases as people get older. But it's important to remember that there are teachers in that school as well. And a child wearing a mask, protects their teacher as well as protects the other children who may have older parents at home or older grandparents at home. And so I think, if something is working and we're able to keep school in session, which is so important, it is so important for kids, for teachers, for parents who need to work, And with this surge in cases, I don't see that change coming, right now. But as always, we look at the data. If the data do indicate that kids aren't spreading it to their parents, that we don't need to do that in schools, that potentially we have low enough rates of transmission within the community that we don't have to worry about as much about transmission in schools, certainly we will make that change when we have to, or when we have the data to back that up. I guess what I would say is if people want to not have to wear masks in places, let's do as much as we can now to get the levels of community transmission so low that we don't have to. It really is up to all of us. Okay. Thanks, everyone. Hi, Morgan. Nice to meet you in person.
On the phone, so it's good to see you.
Yeah, good to see you too. Yeah, I was hoping you would come since it's not too horrible a drive, but the roads are terrible.
2 hours is like 45 minutes.
I know, yeah.
I'm from Wisconsin, so.
Yeah, all
like,
right. David, nice to see you again.
Things are closer.
Yeah.
So when I moved out here, I kind of got used to the.